OCO and welcome to the Cherokee Phoenix Breakdown. I am Tyler Thomas, the executive editor of the Cherokee Phoenix, and I am honored to be joined by Cherokee Nation Behavioral Health Manager of Administrative Operations, Ashley Lincoln, as well as Oklahoma State University freshman and former junior Miss Cherokee Kaitlyn Pinkerton. Today's episode focuses on the suicide crisis in Indian Country. In this episode, we will discuss the rising suicide rate in Indian Country, as well as the tribe's efforts of trying to reverse those numbers through various programs and resources. Ashley and Kaitlyn, thank you for joining me today.
Thanks for having us.
Thank you for having us.
Native people face many health crises across Indian Country. However, one of the most pressing is the rising rates of suicide in Native communities. Since 1999, the U.S. suicide rate is up 33%, but for Native women and men, that rate has increased by 139% and 71% respectively, according to 2019 analysis from the Centers for Disease Control and Prevention's National Center for Health Statistics. A 2018 CDC report found that the suicide rate among Native people was more than 3.5 times higher than among racial and ethnic groups with the lowest rates. Ashley, what are some of the factors that are causing such an increase in America, but particularly in Native tribes?
I think historical trauma, like a lot of times we brush over that and the impact it's had, from forced removals to boarding schools to loss of our cultural practices. That impacts us. That trauma is wired in our DNA, and we hand that down every generation. And so when you already have that predisposition, and you feel those experiences that your ancestors went through, having a mental health concern or anything like that, it's exacerbated. Stigma, there's a lot of things that go into that. We don't talk about mental health. We don't talk about suicide. We don't have those conversations openly because it makes people uncomfortable. And that's a lot of our goal, is to try to have those conversations. Everyone, experiences some mental health concern in their lifetime, so why do we have such a stigma around having those conversations? So you already have those, and then, we live in a rural area. So not having access to transportation, living far out and not having access to treatment, those things like that, they all are a factor into that increase. And then now we're in a pandemic. So, I expect that those rates are going to be even higher.
Yeah. Kaitlyn, in an analysis published by the Journal of the American Medical Association in 2019, it found that the suicide rate for all U.S. teens and young adults increased in 2017 to its highest point since 2000. And that of Native American suicide deaths, more than a third were between 10 and 24 years old, according to the CDC. What are the factors causing the crisis to drastically affect our youth in such a devastating way?
There are so many, but a lot of the big ones are stress. We have a lot more stress in schools. There's a lot of a feeling that we need to be perfect. That I've seen in most of my peers. There's the fact that we're in a pandemic. The social isolation is very hard. There's social media, and there's unrelenting beauty standards for every single person on this earth. And then, like Ashley said, the stigma is really bad. And I've seen and heard from a lot of people that they just feel like they're a burden if they talk to somebody about it. And that's a really bad way to feel, because if we don't talk about it, then it's never going to get better.
Ashley, data may be scarce right now, but given that we are still in the midst of the COVID-19 pandemic, what effect has the pandemic had on these rates?
Working in behavioral health, we've had an increase in all ages of patients experiencing depression, anxiety, suicidal ideation. Like Kaitlyn mentioned, media, we're in the midst of a pandemic. You can't get on Facebook, you can't watch the news, you can't turn on the TV because you're inundated with all of these, things of what's going on in the world and being isolated. Especially among youth, a big part of that identity is your peers, and those being in school and doing those extracurricular activities, whether it's drama or sports. And we haven't been able to do that. You can't hang out with your friends. You're socially isolated. And we're having to find a new way to learn, and a new way to interact with people and be creative with that. But it definitely has effects on our mental health. And then also feeling like everyone is going through this. So like Kaitlyn said, that stigma, we're all in this together. And if I'm not able to cope as well as my friend, I don't want to tell them about it, because I don't want to burden them, because we're in this together. And so not feeling like they have the space to have that conversation. Yeah, I mean, the pandemic has been, you're scared of your family members getting sick on top of that. So on top of worrying about your own mental health, you're worried about your physical health and your family's physical health. And it's just a really stressful time all the way around.
Yeah. Ashley, we've spoken about the rising rates and the factors contributing to those increases. How's the tribe addressing this within its reservation?
So in behavioral health, we have a ton of different grants to address just this issue. We have our Garrett Lee Smith Suicide Prevention Grant. We have prevention programs within behavioral health. And so some of the activities we're doing is with our Garrett Lee Smith grant is we are located in 2 schools, Sequoia High School, Hulbert High School, and we're doing suicide and depression screens with students. And then if a student screens positive, we connect them to care. So it's a public health approach, and we're screening everyone. But if we catch a student that's struggling, you were asking those questions, and we're able to get them help. Also, I know I keep saying stigma, but that stigma is so huge with behavioral health and everything in general. A lot of our efforts are on social marketing, because we do want to have those conversations, and we want everyone to feel like they have the space to have those conversations. If you broke your arm, I wouldn't expect you to suck it up and deal with it. I would expect you to go get care and to tell someone, like, I'm hurting, I need help, I need to go to the doctor. And so we want mental health to be seen in the same light. We work with, we have a zero suicide grant. We have family care managers who are calling everyone who's screened positive in our health system. And they're just saying, hey, we have these resources here. We care about you. We want to check on you and see what's going on. And when you're ready to get help, and if you need help, we have it. And in behavioral health, we triage all of our referrals, because we want to see as many people as we can. And so if we get a referral and somebody's really struggling, we want to make sure that we're able to see them. And so, I mean, we have a lot of different activities, and we're trying to hit on every level. So public health, school, clinical, one-on-one. And, we also have youth mental health first aid that is available to anyone that comes in contact with the youth. It's a free training we offer. And that training is specific to suicide. It gives you the skill set to say, are you thinking of killing yourself? If so, I know how to get you some help. Those are hard conversations to have. And we're able to offer that training free. We do it a lot with schools and educators. And so, yeah, if anyone is ever interested in those, behavioral health has that available. It's an 8-hour training, and you're certified for 3 years. So, yeah, we have a lot of different things going on.
Principal Chief Chuck Hoskin Jr. has recently put into place several initiatives that focus on mental health. Ashley, how does suicide prevention factor into Chief Hoskin's initiatives?
I mean, the Chief and Health Administration have been huge supports, because we know that people don't exist in a vacuum, and, we need to change our approach up. So yes, we can meet with everyone one-on-one, and we can do clinical intervention, but we also want to do these activities that are very widespread, and we want to give people these skills and give them resources to access, because the thing is, we have a ton of educated professionals, but we can only see so many. And so we want to be able to push out resources. We have our outlying clinics. We have, our clinic here at the Cherokee Nation, the outpatient health center. And, it's been a huge support, because like I said, it really helps with that stigma when you have, our administration saying, we recognize this is a problem. It helps those, because they're like, hey, if I'm having this problem, I know that I'm going to get help. And I know that my tribe is invested in it too. And I know where I can go for help. So I'm really excited about what's to come. And I'm excited for us to expand those services. And, we're in 2 schools right now. And, I would love for us to be able to broaden those activities as well. So yeah, it's been amazing to have an administration that is so invested in mental health, and to have our health administration who is invested in mental health and the services that we're offering.
Yeah. Kaitlyn, as a freshman at Oklahoma State University, what efforts are outside of the Cherokee Nation programs and resources do you see being specifically targeted toward suicide prevention for Native people, especially the youth?
So I don't see many, which makes me sad. I see there's some on the media, like on Instagram, and a really big one, or a really big platform is TikTok. And especially now, since it's Suicide Prevention Month, and there's a lot more in November. But for that kind of stuff, you have to be on the algorithm. So not everybody sees that. And it's only a few specific small Native brands or advocacy pages. And so there's not a lot of suicide prevention for Native youth that you see typically in your day-to-day life.
Yeah. What I know, as a junior Miss Cherokee, that was part of your platform. Can you speak a little bit to that?
Yeah, so I always say that it's, it truly is an epidemic.
Mm-hmm.
And it's going to continue to just wipe us out if nothing is done. So seeing a lot more people talking about it, addressing the stigma, and being open about it, especially on not just like on our own reservation, but on others all across the United States. It's something that really needs to be done, I guess.
Yeah.
Because nobody's going to reach out unless we feel like we can talk about it. And I know my friends on reservations out in the West, and up north, they feel like they can't talk about it to anybody near them, and that's not a good thing, because then we just hold ourselves up. Particularly like youth, we tend to just kind of bottle up our feelings because that's what we see a lot of adults doing, and so it just gets worse when we bottle these feelings up, and we don't have outlets to take care of it. So that's another thing that I like to talk about, is we need outlets to express our feelings and to get them out, whether that's like a creative outlet or social, or going out and exercising, just anything. We don't have these resources that we need to survive and thrive.
Yeah. Let's talk about identifying those feelings within ourselves or those close to us, and how we can address them in a healthy way as to protect our lives and the lives of our loved ones. Ashley, what are the signs that people may be able to recognize within themselves or others that suicide thoughts or feelings may be happening?
So just with your peers, with your family, seeing different behaviors, giving away their prized possessions. They don't have to be expensive ones. I mean, giving away maybe your class ring, or, my favorite band shirt, anything like that. Making light of death, or talking about it more openly than they have before, and withdrawing from activities. So, maybe if you used to hang out with your friend all the time and do these things, and then now they're like, no, I'm just going to stay home by myself, that could be a cause for concern. And we want to encourage people to ask that question, because everyone's afraid to ask that question because they're afraid of the answer. Because if the answer is yes, what do I do? Yeah. I've opened a can of worms here. What do I do? And so Youth Mental Health First Aid teaches you ask that question. Are you thinking of killing yourself? And you ask it with confidence. Because if I say, are you thinking of killing yourself? They're not going to feel confident to answer me, because they don't want to burden me with those emotions. And so, if they say, yes, I am, I'm going to say, okay, I'm going to sit right here with you. And, I think we need to talk to somebody. who's a supportive adult in your life, or who would you like to talk to? But I'm going to be here with you, and we're going to have that conversation, because no one wants to feel that way.
Yeah.
And, that's another thing that we talk about is like, when you experience these big emotions, I mean, even as adults, we experience these big emotions. It's hard to think of them going away. And it's hard to look past, not being in this moment and feeling this way. And so, we want to encourage youth, like, we can learn coping, we can learn those emotions, we can learn ways to get past those emotions. We just have to reach out. We have to reach out and talk to somebody, and we always say it's okay to not be okay, but it's not okay to not ask for help. Yeah. And, that's what we want to be able to have access. We want to, increase access to services. So if someone reaches out and say, I need help, we want to be able to help them right then, because, it's a big deal to be able to come up and say, like, hey, I'm struggling. I need help. Can you help me? And so we want to be able to address that.
Kaitlyn, kind of expounding on that, if a person recognizes the feelings within themselves or someone close to them, what steps do you think they can take to address it in a healthy way?
Just like Ashley said, reach out. If you feel like, if you see this in someone, like one of your friends or a family member, just flat out ask the question, do you want to kill yourself? And, sit with them, see if you can help them find resources, but never just like, kind of be like, oh, okay. Cause I know some people would do that. And another really big thing is ask them if they want you to like actively listen and try to provide support while they're talking to you, or if they just want you to sit and listen. Because I know that sometimes, we just want somebody to sit and listen to us. We don't want somebody to try and come up with solutions to all of our problems. We just want somebody to listen to us and say that they're there for us whenever we need them. So always, ask that question of, do you want to kill yourself? But then also ask, do you want me to actively listen, or do you want me to just sit, listen, take it in, not try to solve all your problems? And then if you're feeling it, if you think that you are suicidal, if you think that you want to kill yourself, reach out. It's hard. I understand that. I've been there. But reaching out does you so much good in the long run, because if you don't, like I said earlier, you just bottle these feelings up until you can't take it anymore. And so reaching out to, a trusted family member, a close friend, your favorite teacher, professor, any person that you would want to provide you that support that you need, reach out to them. If you think that you're burdening them, you're not. And you just, you need to have these support systems to help you get better.
Yeah. Ashley, what resources would you recommend to people in regards of counseling and or literature or anything of that nature when it comes to suicide prevention?
I mean, the Substance Abuse and Mental Health Services Administration, SAMHSA, they have a lot of amazing resources on their website. The Suicide Prevention Lifeline, you can call, you can text, and they have somebody that will be there to talk to you. And Kaitlyn, I am so thankful that you said, coming up with solutions, because, as an adult and even as a parent, if somebody I love and care about is hurting, my first instinct is I'm going to solve your problem. Like, we're going to solve this together. And how important it is to listen. And research shows that suicidal thoughts are common. Everyone will have them at some point in their life. What's not common and what, when we need to intervene is when you have thoughts of acting on them. There's a really good website too. It's We Are Native. They have a lot of amazing resources. They have suicide prevention. They have substance abuse prevention. They just have, they have LGBTQ resources. They have all kinds of things, and it's specific for Native youth. It was built for them. And, you know, I have not met one person who hasn't got on that website and absolutely loved it. So I encourage everyone to look at that website too, because it has a lot of great information that you can use.
Yeah. Kaitlyn, anything to add to that as far as literature resources on that people can access?
No, though We Are Native, great. Yeah, just We Are Native. It's such an amazing resource.
Ashley, is there anything more you would like to offer before we end our virtual roundtable discussion today?
No, I'm so thankful that we were able to have this conversation and be on a platform where we can openly talk about suicide. And, you know, like I said before, it's okay to not be okay, and, you know, and to reach out for help. And at Cherokee Nation Behavioral Health, they have resources available, and, you know, you can call at any time, and, you know, we can do what we can to address your needs. And so I just encourage anyone, youth, adult, if they're having, you know, thoughts of suicide and thoughts of killing themselves, to definitely reach out to someone. If they don't feel comfortable reaching out to us, you know, reach out to a friend, a family member, and just tell them, hey, I'm struggling, and, you know, let's get through this together and figure that out.
Yeah. Kaitlyn, anything to add before we conclude?
Just reiterating what Ashley said, just reach out, because it'll only get better. And, you know, the best way to do that is not trying to go through it alone and getting help to go through it.
Awesome. Ashley and Kaitlyn, thank you for joining me today and discussing the suicide crisis within Indian country and the tribe's efforts to end it. I also want to thank our audience for watching this episode of the Cherokee Phoenix Breakdown, and be sure to follow us on YouTube, Facebook, Twitter, and Instagram to watch our next episode. What up?